I'm part of Unity Hospitals Association and I'm chairing tonight. Eleanor is recording this session because these sessions go on our YouTube so that other people can access them. So if you're not comfortable having your face on camera, please do feel free to turn your camera off. Lucy is going to be sharing her work with us tonight, so we'll hand over to her and she'll introduce herself and her piece of work and how she'd like questions to come. But if you think of anything, just pop it in the chat and we'll monitor that as well. Okay, over to you, Lucy.
Thank you very much. And thank you for having me. If I just share my slides, and if I could, I'll just allow some time at the end for questions, if that's okay. So my name is Lucy Somerville. I'm a professional development nurse for Sussex Community, and my portfolio is looking after our healthcare support workers for their inductions and ongoing development, care certificate and professional development after that. So this development program came about as an opportunity for us to expand the knowledge and skills of our existing healthcare support workers. And this particular, sorry, just going to try and move, there we go. So this slide just shows the poster that I submitted on the back of the design of the projects that we worked on. So this was innovation in healthcare for our support workers. So we developed a preceptorship and development program for our Band 3 staff. And that's the poster that we had submitted. So the program itself is a 6-month program designed for all our clinical support workers to attend, as I say, following on from their normal induction and care certificate training at the beginning of their starts with us. And it's designed for all Band 2, 3 and non-registered 4 staff to attend. So it has the idea to, sorry, just 1 second. The screen's just doing some silly things. Right, thank you. So the 8 study days over the 6 months is designed to be taught face-to-face to help with that peer learning, networking, and valuable sort of classroom learning that goes on with the activities that we've chosen for their development across these different topics within the content of the programme, which I'll talk about in a moment. And it's relevant for all our support workers, whether they're in nursing or allied health professional fields, and across all of our different specialist services. And in Sussex Community, we do have a wealth of different services, including our children's, adult, elderly care, end of life, and there are different settings as well, including inpatient, outpatient, and our specialist community services as well. So once they've done the usual induction training, care certificates, skills, this is the next step in terms of their professional development. And it came about from them, the actual healthcare support workers, wanting something else in their own professional development, because as most trusts, I think, may recognise, as a healthcare support worker, if you do your induction, your care certificate and your clinical skills and competencies around what you need to do for your specific role, there may be quite limited ongoing training forward after that. So this is where this gap was identified, and we wanted to respond to that. So the programme itself is based on the postgraduate MDT preceptorship model of development, and it's also based around the NHS healthcare leadership model and the 6 Cs from NHS England. And within the programme, we develop opportunities for the staff to create their own quality improvement project as well. And at the end of that, we want them to be confident and competent practitioners. So as I say, the main aim is to assist our learners to become confident and competent in what they're doing to meet the needs of our service. And they must be already employed in our unregistered workforce. And we do have lots of different roles within that for bands 2, 3, and 4. So we have lots of therapy and nursing type assistants, technicians, re-enablement assistants, lots of different specialties. And the aim of this was to seize that opportunity for ongoing learning for our experienced healthcare support workers, so that they could really stretch and develop in their role as a healthcare support worker. And if they did want to go on and do other types of training or professional qualifications, then this would be a really good bridging towards that to gain their confidence and develop some new skills. The Sussex Community Values, just at the bottom right hand of your screen there, this is what the programme was largely based on. So the values that we want to demonstrate in our everyday care: compassionate, ambitious, working together and delivering excellence. This is the model that we framed it on when we're choosing our topics. So the programme consists of those 8 days, as I say, and it does stretch across lots of different topics. So we have leading self-training based on the NHS leadership model, quality improvement crash course, so they can go away and bring back a quality improvement idea that is specific for their team, their service, that they will initiate. We have discussions around career development pathways. We have workshops regarding allied health professionals, so just opening up their scope of what's out there, their opportunities, different types of roles and services that they may not have thought about. We go into buddy training, supervising peers, communication skills, increasing that workplace culture, and patient safety awareness training. We have a workshop around clinical decision making and how that supports change and the varying factors that influence that. There's a focus on reflective practice throughout the programme. And we have the trust psychologists deliver the trauma-informed care training as well for this particular programme. And all in all, we do focus a lot on the wellbeing and building resilience of our staff. So they've got that backbone to fall on as well. And this programme actually finishes the last day is their presentations of their quality improvement projects. So we get them to design a poster or a presentation, however they want to display that. And they deliver their quality improvement idea. And by this time, some of those projects are actually underway, so they can actually tell us the results or the data around that and the communications that are within that quality improvement team. And we use a multitude of learning and teaching strategies, so try and get the best learning environment for all the different types of learners that we have out there. And we do consider those with the neurodiverse need as well. So we have a sort of confidential questionnaire at the start of the programme to identify anyone that may need further support. We try and nurture that safe environment so they can come forward, and we can assist with that as much as we can with the technologies that are out there. We use that for classroom-based learning, flipped learning, small group exercises, problem-based learning, case study learning, and patient scenarios. So it's all designed to ensure that they can contextualise what they're learning and put it into practice for when they leave, when they go back into practice after the training. So this is the curriculum, and the topics here are listed according to our trust values. As I say, they are the kind of centre of what we do. So within that centre circle, this is how they kind of interrelate in terms of the topics that we discuss. So we want to enhance their compassionate care through managing difficult conversations and conflict training. We have the enhanced dementia and trauma-informed care training there. Working together, so raising broadening their horizons, looking at supervising others, reflective practice, and the AHPs. And then delivering excellence through leading self, going on to leading others, supporting change in the NHS and quality improvement, and understanding clinical decision making and those factors influencing that. And as part of the programme, we do encourage them to meet with several of the career and apprenticeship leads within the trust, and the library services come along as well and introduce what they do, and they sign up to that service, so they have an element around that. They can do some self-research on what they want, and we are going to be looking at adding in some new topics, which I've just highlighted there with the stars. So we're going to be looking at mapping this towards the Lambeth model of delivery, towards that. So we're going to be looking at adding in motivational interviewing and digital skills workshops as well. So the actual curriculum itself was grassrooted. It was something the healthcare support workers wanted when we came into post as a project group within this, and we realised that this was a big gap within our healthcare support workers. They have a huge wealth of experience. They are the staff group that are predominantly giving our patients the patient-facing care that's being delivered, and they are the eyes and ears for us as registered nurses and registered staff. So it's really important that the investment is there, the value is there in what they do, and they wanted further development as well. So this curriculum model, the spiral curriculum, allows that learner to explore these complex situations, looking at their critical thinking skills. We come back to the topics, revise those topics, and we look at how those topics within the content, like patient safety or QI, can then be reflected within those topics that we come back to each time that we meet in the classroom. So building on their knowledge, recognising their prior experience, which all complements developing a safe learning environment for them. And within that curriculum, formal curriculum, there is that hidden curriculum as well. So just, referring to those unspoken lessons and the norms that we want our staff to really take on and underpin what we do. So, the expected behaviours and values that we have in our trust. We want the programme for them to focus on reflection on practice, raising their self-awareness, building their confidence in the advanced communication skills, raising awareness of their own influence on themselves, their teams, what they do, through leading others, positive role modelling, improving that working culture, and raising professional standards, building resilience, and supporting change and moving forward with improvement. So all of this we have found has a really good positive work attitude. Building that wider organisational goals into what we're doing, what we're training with our staff, is really important to highlight and invest that element into our staff. This slide is just a snapshot of some of the quality improvement projects that came from cohort 1 that we had back in 2023. And we had some really good projects which are actually still ongoing today and have been taken on at a local level, and some have been taken on at a trust-wide level. So, for example, just starting from the top left there, you've got a poster which was portraying the idea around personalised care planning for nutrition and wound care, and how it's so important that we do really personalise that care in terms of how we actually write the care plans, deliver the care, and how those challenges can be faced, the barriers around doing that. We had something just in the centre, just about to see, which is an order form for dressings, and the person saw a gap in that particular order form where we just needed to add a separate checklist there for ordering separate types of equipment, for increasing patient, reducing patients' delay in what they receive for their equipment when they're coming out of hospitals. There is a bed making project that's actually been taken forward trust-wide. So that bottom left corner there is just demonstrating the photos in those little pockets. There was an idea around food and fluid chart champions and how important that is on the ward for patients that are vulnerable and needing that extra monitoring. So they came up with that idea, and that's been taken forward at a ward-based level for that to be taken on, and it's been very successful in terms of the compliance for our charts. And then there was an oral health promotion. So again, that's been taken on by the ward staff. insulin administration step-by-step guide for self-administration. This was aimed at teaching our patients and their family or carers to help administer insulin in the community, which is absolutely vital for some of our community staff. And there was a proposal for an activities coordinator at our Children's Services Centre, Chailey Clinical Service there for children with neurological head injuries. So all of these ideas were absolutely fantastic, and they came from the healthcare support workers that attended. And as I say, a lot of those have been taken forward through different types of work streams or pieces of research that have been ongoing. They've now actually intertwined that into what they're doing to improve services for our patients. So the outcomes of the programme: the learners consolidate their professional knowledge through reflection, shared experiences, identifying their own knowledge gaps. They formulate their own development plan so they can demonstrate their own accountability for their learning, and we do promote that emphasis on lifelong learning. They review and evaluate case studies in relation to clinical incidences, looking at policies and procedures and how that may inform their clinical decision making, developing communication skills in conflict, building a healthy workplace culture and supporting change. They can identify resources to self-care, health and well-being, and understanding those principles of quality improvement, and then, as I say, presenting that on the final day of the programme. So the impact from the actual programme has been quite vast. We learnt from organisational impacts-wise, striving to improve clinical education and learning opportunities for our non-registered workforce was key, and that in turn will then build reputation and recognition, especially through this sort of channel, and you know, the recognition for the award as well was amazing. So sharing knowledge at national forums, regional forums, and we hope to be publishing an article soon to relay this. We've had a fantastic recruitment incentive, reducing attrition rates, and organisationally we've found that this is one initiative that's had a really positive impact on retaining our staff. From the learner perspective, the learner journey was really important to us, so we want to ensure they're valued in the role and feel listened to, hopefully increasing that learner satisfaction, increasing awareness of their wider organisational and professional standards, and allowing them to develop and build on transferable skills and knowledge that they can take forward, increasing their own professional identity and their confidence as well. And overall, we know this has an impact on our patient care, improving motivation for their role, leading to that improved quality of care and better experience for our patients. So when we reflected on the impact of what we needed to do to gain all of this, the impact evaluation is ongoing, as you can imagine. So we're on just started cohort 4 now. But we've been evaluating and amending as we go. But the overall low investment from the outset was quite low, as this was an in-house training offered by an education team that we were already working towards this when we're looking after the healthcare support workers. So we're just building on the programmes that we're already running. And the senior associate educators that I work with very closely offer that pastoral support and follow-up visits and practice if that is required. So that was a big part of what we wanted to achieve, that they have that support package in place, and they have that extra element of follow-up and one-to-one support in practice. So the classrooms are held on site. So it's really just a case of releasing the healthcare support workers to attend and backfilling those clinical shifts, and then sorting out that buddying system and support system in place for them when they're actually ongoing through the programme. And the main outcomes we saw were improved patient safety and outcomes. The learners felt confident. They felt like they understood how to reflect as professionals. They felt they wanted to stay in their role. They had increased motivation for their role. And we saw that trust engagement was increased and quality improvement engagement went up vastly. So just to summarise some of the outcomes we've had from our cohort. So the first cohort there was 18 learners, and 2 of those have gone on to do their level 3 health and social care module, and then 4 have gone on to do the nursing associate apprenticeship programme. And 1 has now moved into the physiotherapy technician role, which is what he wanted to do. And then the second cohort again had 18, and 4 of those have gone on to doing the nursing associate apprenticeship. So really encouraging that gap between working as a healthcare support worker and furthering their own education to registered roles. Otherwise, we've had a healthcare support worker go on to become an elected governor for SCFT, which is the first healthcare support worker governor we've had. And one of them has also gone on to the Digital Innovation Programme, again, another internal training programme for further development. This last cohort, which was 7, we've had 3 go into the level 3 modules, and then they will apply onto the apprenticeships next year. And one of those is a dental nurse who's also converting onto the UK NMC for her registration here. And we've had another healthcare support worker go on to do a forum, regional forum, to talk about his learning journey and journey in music care as well. So the overall questions we asked from the programme evaluation really was quite compounding the positive effects that we learned. So we asked if they'd had an increased interest of their role. Yes, 91% said yes. 83% said it raised further ideas for training and they would recommend it to their colleagues. And 66% wanted to stay in the trust and develop their career with us. So it's overwhelmingly positive. And we asked a sort of general question if it had a positive impact on them as an individual, both professionally and personally, and 100% said yes. So looking forward, our future ideas we are developing for the cohorts going through next. We want to build in digital skills workshops for those staff members to really get to grips with the IT and the software that's out there now and the different types of systems that we are expected to use in our day-to-day life. This seems to be a big gap that we've had feedback from our existing cohorts that would really appreciate that. Motivational interviewing is another topic we'd like to align with, and if they would like to go on and apply for training at university or college, perhaps we can support that with application and statement writing if that is appropriate. So what we're looking at is aligning this model with the Lambeth model in the future so that we can say that this is directly mapped to those competencies as well. So in the future, we will aim to evaluate and review. We'll definitely keep doing that. That's really essential, taking that staff feedback, survey results and adapting our cohorts as we go forward. Continuing our staff to support their quality improvement projects and their career aspirations as well. And working with both internal, external partners, sharing resources and developing opportunities for the future. And as I say, mapping to the HDA Lambeth model for possible accreditation or working with higher education institutions in the future. So, thank you for listening. Any questions?
Thank you very much, Lucy. That was absolutely fascinating.